Rebecca London. You heard from me yesterday. I'm a professor in sociology at University of California, Santa Cruz, and I'm the research partner with the Silicon Valley Regional Data Trust, very proudly so. And I'm convening today. I'm the moderator for this panel. And the way we're going to set this panel up is we want it to be as interactive as possible. And so each of the three presenters going to present their remarks. Then we're going to have our respondent respond briefly. And then we're going to open it up to conversation, a panel conversation with all of you. If everyone turns out to be shy, I have a couple questions I could ask, but really we'd rather hear from you than hear from me. So let me just quickly introduce who we have sitting up here. In order listed up on the screen here, we have Katharyne Mitchell, who's the Dean of the Division of Social Sciences at University of California, Santa Cruz. When I told you yesterday that we have support for the Silicon Valley Regional Data Trust at the highest levels of administration, I was talking about Katharyne. And here she is. Emily Putnam Hornstein, who's the Director of the Children's Data Network and a faculty member at University of Southern California. And we have Chris Kingsley at the end. He's a Senior Associate for Data Initiatives at the Annie E. Casey Foundation. And then our responder is Marianne Bates, who's the Executive Director of the Poverty Action Lab at MIT. Okay. So I know you don't want to hear me talk. I'm just going to say a couple of things, and then I'm going to turn it over to all of them. Our panel is about, it's a place for us to start talking about what are we going to do with all this information? We're gathering all these data. What are we going to do with it? And as researchers, how are we going to advance the field? What are we going to do to turn this into a field, an interoperability research field? So I just want to come back to the three focus areas that I talked about yesterday in my study, because I heard those three areas resonated in what people said during the course of the day yesterday and today. So the first area of research that I talked about was what I was calling a practice study. So someone said in the room, we have to get the right data to the right people at the right time. And I would add to that, so they can do the right thing. And how do we know that those three things are happening? That we're getting the right data to the right people at the right time and they're doing the right thing. That's the practice study. How is it that we're understanding this process of interoperability and what happens? The second area that I talked about yesterday was analyses that we conduct with the data. And someone, I don't know, I can't remember if it was today or yesterday, someone said, well, how do we do this cross-sector research? What does that even look like, cross-sector research? Well, that's what that question is responding to. How do we use these data to conduct cross-sector research? And how do we think about what that means for each of the sectors that are involved? And then the third area that I talked about yesterday was analyses of the data themselves. And that came up today in terms of issues of data quality. What are the quality of the data that we're getting? And how do we build in data quality standards into the data that we're collecting, that we're disseminating, that we're doing research on? So with that, I'm going to turn it over to, I think we're starting with Katharyne, and then we'll kind of work our way down. If you have burning questions, you can feel free to raise your hand and we'll answer them in the moment, and otherwise try and save up some nice cross-presenter questions and we can have a discussion afterwards.
So thank you, Rebecca. It's lovely to be here. How's the sound? Is it okay? Great. Okay. So you talked about data quality right then, and I wanted to just lead with the general context in which higher education finds itself right now in 2018, which is the unenviable position of being in a place where data is often seen as suspect by the broader population. It's not necessarily conceptualized as neutral and or helpful. In fact, data or facts can be conceptualized as personal opinion or even fake. So higher education now, given this sort of context, is under attack, as we all know. And it behooves us more than ever to show the relevance of data, the neutrality and efficiency and importance of data and data sharing, and particularly that it's not just important for us in the higher education sphere, but for the community as well. And we're very interested in making sure that that community-initiated, policy-relevant piece is in there in any kind of data research that we are involved in. Now, that said, faculty also need autonomy, and I don't want to micromanage as dean. In fact, I can't. You know, if you know faculty, you know that you can't tell faculty what to do. It's just not going to work. So my question to myself is, what are the best ways to incentivize the data that's relevant to the community and the kinds of public scholarship that I would like to see, and also how to incentivize sharing of that data. So I thought what I'd do is to start with some general problems or barriers to doing that I've seen in my 8 months being dean at the University of Santa Cruz, University of California, Santa Cruz, and also some solutions that we're working on now. These are more general, so not specific to education and health questions, but I think in every single area you'll see that those particular areas are tied in here. So the first sort of barrier that I've seen as a dean is the ones that you've been talking about for 2 days, is the siloization of fields. And this is very much true in the university as much as it is in any kind of institution. In fact, perhaps more so. And one of the reasons is that resources flow to specific units. They don't flow to the university as a whole. They have a very much of a channeled effect into the silos. And that flow depends on grants. So if an individual or a department gets a grant, then there's cost sharing benefits that come back to that individual in the department into a specific unit, in other words. And also, many universities use what's called some version of activity-based budgeting, ABB, which is where the resources follow the students. So that can be students, literally how many people are seated in a classroom, or how many people are in a major. And so you find that departments and divisions, so departments being in the social sciences, anthropology, politics, sociology, environmental studies, et cetera, and in divisions, the arts, the humanities, the social sciences, engineering, and physical and biological sciences. In both those smaller micro the departments and in the larger divisions, there's a sense of protecting those units from sharing, because then you might not get these resources to flow to you directly. And that's one problem that I could identify right away. A second problem is, and I'm an urban geographer, so I'm very interested in space. Space is a problem. Questions of how space is divided on a campus. Most of these divisions that I just laid out come from 19th century understandings of how we partition knowledge. It's pretty ridiculous now. I mean, anthropology and geography and sociology, I read in all those fields personally for my own research. Almost all faculty are literally, they're drawing from almost every particular department, and often across divisions as well. Nevertheless, the ways that these universities are set up are where you have the engineering building as one part of the campus, you have the physical and natural sciences in another, you have, social sciences in UCSC are spread out all over everywhere. But in general, it's very hard to find these spaces of collaboration, and people are so busy in our everyday lives that you're not going to just come to a water cooler that's half an hour walk away from your department to talk with somebody about the ways that your research can cross these kinds of barriers. So that's another issue. And then third is this still working okay? Okay, sounded like it went off to me. The third is the question of tenure. Now, don't get me wrong, I'm a strong believer in tenure, particularly in this era of real divisiveness in our country. If we did not have tenure, your students and your children would not be hearing what the faculty really wanted to teach, because they'd be too nervous about their jobs. Tenure is absolutely vital. That said, it does produce certain kinds of behaviors, especially in the first 6 years of a faculty member's career, and those behaviors are to focus more narrowly on the things that are going to bring them advantage. In fact, they have to in order to be able to get tenure. This includes writing for academic journals in a very specific kind of language. Those journals tend to be narrow. If I'm a geographer, I'm interested in urban questions, but urban planning journals are not considered as high in my field as geography journals. So I had to write my first 6 years for geography journals. And I'm interested in questions around education. My latest book is on education. After tenure, I could write in education journals, but before that, no. So you can, but it doesn't count as weightily for you. So that, and then even though, as you know, you receive tenure after year 6, and you think, well, now you can be more collaboratively engaged. You can work across these disciplines. You can do all these things. The habits are formed, and that's part of the issue. And also, you've learned how to write in a certain way, and that way is good and useful, and it helps us to share knowledge within our fields. But it isn't really accessible to the broader public, that way of writing. And so we have to go back and relearn how to write for a broader public, and relearn how to be public scholars. So all those things are kinds of barriers to sharing of data across, even within the university, let alone outside the boundaries of the academy. So here's some solutions that we've been working on, how to break down these barriers and impediments to internal collaboration problems. First of all, I think it's really the responsibility of academic leadership, and by that I mean deans and the campus provost, to make it seems so obvious, so make it so that people can count the seats. If somebody is team teaching, they can count for both units, to make the grants be shareable and less bureaucratized, so that the different research analysts are able to understand how to have a grant be held in PB-Sci and also in the social sciences and also in engineering. Those are things that can be worked out. And so those are things that are possible to do, but need leadership to make it happen, because these silos are, they're, in our case, 1965 campus, 60 years old, and in other campuses, 300, 400 years old. The second thing is to offer incentives of various kinds for various kinds of collaboration. So again, this idea of giving people a reason to go to the water cooler and talk with other people, give them seed money, et cetera, to work together. Secondly, I think there's a responsibility of granting agencies, and I don't know who's in the room, who's funders here, but philanthropists, funders of all kinds, the government, and NIC itself, to do the same kinds of support for projects that do these kinds of cross-divisional, cross-departmental, cross-community research. I can't tell you how important that is for a public university. We simply do not have the internal resources. I mean, Rebecca very kindly said that I was, a very important supporter of the SVRDT, which I am, but I have not actually given her all that much money. She's had to scrabble to find it herself. Now, Rebecca is brilliant, and so is Rod, and everybody else is involved in this project, but for the normal faculty, average faculty, to ask them to be constantly going out and getting money at that scale they know how to do it once in a while, but it's difficult. And to have incentives where they can see where it is and what they should do is so important. And then also to provide a central space on campuses for sharing ideas and speakers, making them thought collectives where people want to be, the speakers who are exciting, that you'll come. If you're in engineering, if you're working in the community, you want to hear the speaker. You want to hear Bill McKibben, who, by the way, we're bringing in May. We want to hear these people who are really changing the world, and we all want to hear them, not just someone in a narrow field. And we need to have those spaces be accessible by the broader public as well. So those are, and then just little things like we need to think about reworking the tenure process so that research that's collaborative and with the community of various kinds of public scholarship count in stronger ways for tenure. That doesn't mean, I'm also a believer in sort of critical thinking and basic science where you're not sure where it's going to go. I don't ever want to say, my faculty shouldn't be allowed to do that. That's very important as well. But I think for those people who really want to be engaged with the community and share their ideas and have them implementable, we need to have a tenure process that counts what they do at the same level as academic journal articles. Okay, so finally, do I have enough time? Okay, this is just a couple examples of what we're trying to do at the University of California, Santa Cruz. The campus provost is new, and she has started a strategic academic planning process. One of the main questions of that process that have gone out to all faculty is, what are the barriers to your doing more kind of shared collaborative work? And I, as a dean of the social sciences, I'm starting a Santa Cruz Institute, which is going to be a galvanized community-initiated policy-relevant research with seed money grants, with think tank forums where we bring in these kinds of interesting speakers. I'm finding central spaces where people can meet and hold these colloquia and these speakers. We're going to use the Silicon Valley campus where actually Rebecca is presenting her work with two other people, one from sociology and one from economics, to talk about their collaborative, community-oriented research in May. And it's a forum where people, it's a part of the campus of the university, but it also feels like it belongs to the community. So if some people are nervous about coming to the university, oh, they don't belong, you need to have those spaces where everybody feels like they belong, and you need to have events that reach out to them from those spaces. So that's all I wanted to start with. Very much specific to the academic world, the social sciences, but I think this might get us going, talk more specifically about education.
Terrific. Hi, everybody. I have to admit, I had 14 slides that somehow disappeared, so whoever took them, the rest of you should thank them. But what I'm going to do today, and I will just take a very small number of minutes here, is I'm going to provide a really concrete example of how, as an academic partner, we were able to work with the state of California to generate some knowledge that just, didn't float out there in terms of maybe this will be something that's useful, but was actually a project that was very much driven by the state's needs for some data. So this surrounds predictive risk modeling, a nice controversial topic in the area of child welfare. And it dates back a few years in the sense that Los Angeles County's Department of Children and Family Services decided to begin exploring, are there ways that we can make better use of the administrative data we have in our county to support very, very front-end decision making. So I suspect that many of you are not child welfare experts, but just to give you some sense of the scope here, in California we have 500,000 unique children who are reported for abuse or neglect every single year. So you can imagine what a monumental task that is for frontline staff fielding these calls at hotline and trying to figure out, should we screen this in for investigation or should we screen this out? Because this is not like a system where you call 911 and someone's going out. There's actually a decision made just based on what is communicated over the phone. So LA County was kind of out of front, wanted to better understand whether there are ways that they could make use of data to improve the quality of those really, really important initial screening decisions. What happened is they ended up partnering with a vendor who came in to do a proof of concept to give back to them, hopefully, information that would then inform a data analytics strategy. So the question was really, do you have enough quality data so that you should think about making larger investments in these front-end risk analytic tools? Unfortunately, what happened is that the nature of the agreement and the work with the vendor was such that the algorithm that was developed was owned by the vendor. And so the county was presented with what appeared to be really, really promising findings in terms of how this could improve practice, but they couldn't independently validate or verify those findings. And they couldn't see what was going into the secret sauce because they'd handed over lots of data, and they really didn't know how everything was weighted, which made it a really challenging task for them to begin the community engagement process in terms of, here's this new analytics tool we're going to be using. At the same time, very similar work was taking place in Allegheny County, Pennsylvania, where we have heard about what amazing data they do have because they've had this long-standing investment in integrated data in the form of a data warehouse. And so the county also wanted to better understand how they could use some of that data to improve front-end child welfare decision-making. I was a part of a research team that came in to develop an algorithm which has now been implemented and is actually being used at Hotline. But the question that was surfacing for the state of California and lots of other jurisdictions was, well, can we actually take what Allegheny is doing and scale that and use that in other sectors, or is Allegheny truly unique because they have all of this interoperable data? And so unless you're at this stage where you have a kind of a massive data warehouse, maybe there's really no there. So as was mentioned, I'm at the University of Southern California. I have worked closely with the California Department of Social Services for over a decade. And the state approached us with an interest in exploring two different things. One was just from a research standpoint, can you go into our historical child welfare data and in a very open and transparent fashion tell us whether the quality of the data is such that we should be thinking about data analytics tools at Hotline just like Allegheny is? Or is it really not the right time for California because we don't yet have all of this kind of cross-sector data that in theory might be needed to develop an algorithm that predicts outcomes with any degree of accuracy? And then the other question that they really had was, is this something where if the findings are promising, this could be deployed across multiple counties, or are we finding that there's a whole lot of variability? And as researchers who had worked with the administrative data for years, we were able to go in fairly quickly because we knew the structure of the data. We partnered with our colleagues at the Child Welfare Indicators Project at UC Berkeley. We partnered with colleagues from New Zealand who had worked on the Allegheny model build. And we partnered with internal state analysts as well as 3 counties that came to the table and said, we're interested in these findings and we'll also work with you to think through how this could potentially be implemented and how it would fit within our current business practice, because nobody's interested in kind of new tools that hang out there and don't fit with the workflow. And we know what that looks like in our county. And those counties were San Francisco, Los Angeles, and Monterey. So I think this was a perfect example, or this is a perfect example. I want to be very, very clear that I'm going to present a few of the findings that have emerged from this study, but it is still just that. It is a study. It will be disseminated, it will be critiqued, it will be examined, and meanwhile, kind of there are discussions around how it could be implemented. But the key piece is that everything that we have done served our needs in terms of interest in research and the potential for building out these tools, and yet has also given the state and the counties a great starting point because they own the algorithm. So all of the intellectual property that was developed in the course of mining these data belongs to them. And that means that they can hand it off to the right technology vendor to deploy if the decision is made to implement it. It also means that they can work with others to examine questions of equity and racial disparities in a very, very open fashion, which is really important for community engagement. And so we did. We went in. We actually pulled from the administrative data more than 3.4 million referrals that had come into the state of California between 2010 and 2014. We coded up all of the data so that we could look at what information did we have at the time a call came into the hotline, if we look back in all of our historical data going back to 1998, and with what degree of accuracy can we predict future system involvement out 2 years. And that's something really important to underscore here. We know that we can't predict true abuse and neglect, but what we were looking to do here was to figure out how data analytics might help move towards more of that tailored, person-centered approach, recognizing that not every child and family who experiences a report of abuse or neglect necessarily needs the same level of intervention. And to kind of just highlight some of the findings, and this is where you'll either be happy I don't have slides or wish I did. What we did is we used this algorithm, which is pulling in over kind of 300 fields from the historical data. And we kind of played the game. If we ran this algorithm and we used it to distribute children and families into one of 10 buckets. So you've got 100 calls that come in on a given day. The algorithm is being run to distribute those families into buckets of 10% each, score of 1 to 10, 1 being the lowest risk of future system involvement, and 10 being the highest risk of future system involvement. If we run the algorithm, can we actually distribute children where we see meaningful differences in future outcomes? And what we were able to show is that we could identify 10% of children in referrals where if we look out 2 years, fully 1 in 2 of those children are subsequently placed in foster care. So that's a group where you would want to make sure that as much as you have more experienced caseworkers or potentially more services to offer, you're really thinking about it from a prevention standpoint. We also identified at the low end of the risk distribution that children there, 1 in 100 goes on to be placed in foster care. And we identified significant numbers of children in the low risk group where current practice is that we are screening them in for investigation. And so it raises the question, could we start to use tools like this to triage some of those lower risk families onto more of a community path? Working with community providers, and for the high-risk individuals, could we do more from an intervention standpoint? So I will stop there, but I just wanted to give that as a very, very concrete example of how, as academic partners, we were able to move very, very quickly forward with a proof of concept that gave the state and counties information that they were looking for in making some kind of strategic decisions out a few years in terms of investments in different tools that they otherwise didn't have because there was this question of how quickly could it be done, and if we work with a vendor at the outset, do we need to go through a competitive bid process? What will we be able to own? What will they own? Thank you.
Congratulations, that's real progress. Am I allowed to ask a quick follow-up question as a panelist? Doctor? You're waving me off, okay. Sure. My name's Chris. I feel like I snuck onto this panel because I'm not a researcher, but it's an honor to share the stage with those of you who are doing some of the heavy lifting. So I'll try to keep my comments fairly brief and then maybe leave us with a couple of leading questions that can go into some response and discussion. Annie E. Casey Foundation is not a foundation that cares particularly about technology as a rule. We're a foundation for children and families. And this is really true. I love my boss, but if there's a meeting that I would rather, for whatever reason, she didn't attend, if I put interoperability in the title of the calendar invitation, more times than not, she will skip it. So this is an interesting room for us to be in. We do care really deeply about evidence for policy and for practice and for advocacy as well. And so we've been supporters, and my boss has been a supporter of integrated data systems for 5 or 6 years now in fairly significant ways for Casey. Integrated data systems, the terminology we use are IDS. We don't tend to mean by that the kind of 360-degree client view, real-time service coordination that SVRTT and Montgomery County and others are undertaking. I think that's really admirable. What we do mean by that is that there's an established governance procedure where the legal issues have been worked out, and there's a technology architecture such that PII, individually identifying information, can be connected across agencies on an ongoing and sustainable way, right? For a couple of reasons. One is I think resonant with the discussions we've been having in this room for the last day and a half. A lot of the biggest problems we collectively are trying to solve are of those multi-system types, and so we need to be able to see across these different service sectors. The other is that we have just found that it is too time-consuming, it's too expensive, it's too hard to build these things in a ad hoc manner, right? And on the funding cycle of a foundation where we might have a 3 or 4 year engagement and then really wish there was going to be rich integrated data on the far end to be able to evaluate and find out whether or not it worked. So I think that from the perspective of funders, both philanthropic and public, we need to find ways to have a longer time horizon and to be patient investors in the kind of data infrastructure which we know we're going to want to have available. As we were getting some advice on putting the panel together, you did ask for specific examples, so I wanted to give just one or two to put the eyebrows on this, as Frank Zappa used to say. Both these are from Cleveland, as it happens. Some of you may know Claudia Colton in Cuyahoga County, who's been at this for 2 decades, more or less. At Case Western Reserve University, they have a Center for Urban Poverty that has 2 integrated data systems, actually. One's called CHILDS, and is an acronym, and it has 500,000 records on students that are either born, or young people that were born or lived at some point in Cuyahoga County all the way back to 1992. And the other is actually an integrated property database, which has got sales records and permits and vacancy notices and everything you can imagine about the physical infrastructure of those neighborhoods. And we talk a lot about social determinants of health in rooms that stewards convenes like this. I think there's an analog around early childhood readiness and kindergarten school readiness in the education field, right? Where we know that a tremendous amount happens between the ages of birth and age 5 when you might enter school, and that a lot of the achievement gap is kind of baked in by the time that schools have these students present for instruction. So back in 2010-ish, Cleveland was getting hammered by the Great Recession. There were big foreclosure crises that were disproportionately located in minority and low-income communities, and Claudia was trying to ask the question, what is the consequence of building vacancy and dilapidation, kind of neighborhood decline on student readiness for school? And it turns out it's a fairly simple question to ask. It's a really difficult one to answer because you need to be able to connect kids' lives 0 to 5 to their academic record, first off, which not every place can do. You need to be able to connect, in some cases, children to their parents to understand protective factors and what else is happening in the social services arena. You need to be able to attach those people to properties, which is an additional challenge. And then finally, there's an element of geospatial analysis. We're just trying to get an understanding of the proximity of the families we care about to those vacancies and dilapidated houses and what the consequences might be. So they published the results of that study a few years ago in the Atlantic Monthly under the title, I forget what the title was. And the results first demonstrated the effects of neighborhood decline on decreased childhood literacy. It also looked at the effect of that disinvestment on increased likelihood of family instability, increased rates of child abuse and neglect, increased exposure to lead as well, which may not be surprising, but is a really, really big deal when you talk about kids' ability to learn. Interestingly, low housing values were not correlated with any of those negative outcomes. So it wasn't the cost of the house, it was the condition of the house, and not just the specific house, but the surrounding houses in the neighborhood. So that's the kind of, just from a research perspective, that's the kind of thing you can do if you've got a pre-existing relationship with the government such that you've got an awful lot of data which has been cleaned and is well understood, and that you've been doing this for some years. And that just isn't true very many places. So it's kind of a renewable resource that exists in Cleveland. I wanted to give one other quick example of moving past the research, as instructive as that is for policy, to think a little bit about spurring action in the public sector. And this was Cuyahoga County again, wanting to take kind of a 2-generation look at 2 fairly disconnected social services systems. They've got a County Office of Homeless Service, which has the usual information you'd expect from HMIS on women who present at the shelter. They don't always know about mothers with children unless they present at the same time with their children, and that isn't always true. The information on those children, especially children in care, typically lives with their Division of Children and Family Services, which has some information on the mother, but is apt not to be notified if a mother becomes homeless or is receiving other services from the county. So with some analysis, again, working through Case Western Reserve University, and with Claudia, they discovered an overlap of, it was not huge, but of about 100 kids in foster care who had mothers that were receiving services from the homelessness system. And that wasn't a connection that the systems had made before. The children in those families spent on average 30% longer in the foster care system before they were placed or before the families were reunified. And they tended to have worse outcomes. They also, just from a dollars and cents point of view, for the budget officers among you, cost the county more because they estimate the per day cost of foster care at about $75 in Cuyahoga County. So when you zoom in on the mothers in this relationship, what you find is they often have several disadvantages which lead to these challenges, right, related to health, mental health, substance abuse, and oftentimes they were victims of abuse and neglect as well. So the partnership they put in place is this pretty integrated wraparound service for these families, which has a few pieces to it. One is to really quickly identify mothers who are eligible, who have children in the foster care system when they show up in the homelessness system, to prioritize their availability for supportive housing, and to make sure that they've got counseling services to try to stabilize those families and either create a quicker reunification or a quicker decision about the disposition of the child. The basis for being able to do that, because it's expensive, and this gets to Uma, a point you were making yesterday, is you still got to have that upfront money, right? And they did a calculation of what it was going to cost them. It was somewhere on the order of $5 million. And the way they plugged that gap was they issue what was the first at the time social impact bond at the county level in the United States. And they did that on the basis of really solid data on evidence-based practices, on a really clear understanding of the sort of service challenges of the people they're talking about, of the clients they were looking at. They've gone on since to issue 2 others of those, and just, this is, I guess, anecdata, but it's been my experience talking about this with other folks who have done social impact work that it tends to be the states and the counties that have access to this kind of rich data that are able to be opportunistic about taking advantage of interesting outcomes-oriented contracting arrangements to cut the kinds of public-private deals that can bring dollars in for social impact finance. But you can't do it, in a couple of years. Again, it needs a longer sort of cycle of investment in the underlying data. So again, that's why Casey cares about this idea of a multi-purpose fixed, we know it's expensive, but let's invest in it, kind of longer-term infrastructure for research and for public innovation. There's different ways of going about it. It can live different places, as we've talked about here. I don't think anybody's ever claimed that it's easy. But we're finding an increasing number of counties and states that are getting these things built. And in fact, Casey's providing technical assistance to 16 communities at the moment, mostly states, a few counties and cities that are leaning into this. So we're hoping that there'll be some additional progress in the next couple of years. And I wanted to conclude, if you don't mind, with just a couple of things, I guess, that keep me up at night. It actually related to some of the earlier commentary on the panel. One is that I worry that only a fraction of the investment that we're making in interoperability, and I think of like the 90-10 match and all the money coming in from CMS to build out these systems at the state level, I worry that only a fraction of that will actually go into the kinds of evidence that can be used for what I just described, for smarter policymaking. I think the worst case scenario is that sometimes these things become captured as IT projects, and those have a particular reputation as I was just having a conversation with state legislatures and their ability to invest in them over a long period of time. Somebody yesterday said that we are in the habit of building systems that get these results, right? They look this way for a reason, and they look this way because they're about delivering programs. They're not about research and policy insight. But I think that this tremendous investment is meant to get us more than just that narrow focus on accountability. I think it's meant to get us some actionable intelligence. So let's think together about how to ensure that happens. The one other thing I wanted to mention is related to, Dr. London, you mentioned this yesterday, this question around ethical research and intervention. So IDS creates these new and, as Emily, you were saying, powerful ways of modeling risk, of thinking about how to target certain populations for interventions. And with that power, I think, comes a great deal of additional responsibility. We know that vulnerable populations are overrepresented in our systems as a function of historical racism and bias. The administrative data we have is not complete and it's not neutral. So there's some question about what you do about that, but at least it's a good basis to begin the conversation, to recognize it. And it raises other questions for me that I don't have great answers for. One is, does it matter, and when does it matter that these algorithms are developed by, let's say, a university partnership with the state of California versus Palantir coming in and doing it? How do we scale this, right? And what guidelines do we put in place such that whatever that partnership looks like, the government has the right protections in their procurement? So I would love to talk about that. The second is, how do we meaningfully engage communities in this work? And I don't mean to pretend that's easy. I think in many ways building these kinds of data systems is kind of an inside game, both because it's technical and because it relies so deeply on the trust of state partners who you've got to get on board before you open this thing up to advocates in the community. But at the same time, there's a real reputational risk to this work if it gets too closely associated with surveillance, and if the civil rights community and others decide that they're not comfortable with the kind of purposes that their data is being repurposed for, right? And so I think addressing that up front, thinking about how we communicate as a field and acknowledge that may be important. I don't have a great answer about how to message that, but if anybody else wants to talk about it, or folks on the panel have ideas, that would be terrific. And I'll turn it back over to you, Rebecca.
Thank you. So I'm going to try to pull together a couple of themes from the conversations that we've just had on this panel. And my frame of reference for this is from the perspective of the work that we do at the Poverty Action Lab. And a lot of the work that we focus on is helping connect state and local, and in some cases federal government partners and service providers with academics. We have about 150 in our network who specialize in doing, in our case, randomized evaluations, which is a subset of impact evaluation more broadly in the real world. So in some sense, we're kind of consumers of linked data, consumers of interoperability, and a lot of what we do is matchmaking, so helping people who have similar questions come together. So that's my frame of reference for this work and the work that we do. A couple of themes jumped out at me from the comments that we had so far. One is that this work of linking data together and making it interoperable is a means to an end. It's not the end goal in and of itself, right? Why do we do this? It's because we care about improving outcomes for kids, right? The very high number that Emily mentioned who come, just within California alone or in the child welfare system. And the second point that I think you just highlighted very effectively is that the kind of infrastructure that is built when we do this work can position different jurisdictions really, really well to take advantage of other things, whether it's creative financing like social impact bonds or pay for success, or other funding mechanisms that can increase the level of investment available to the communities that we're serving. So the first point was, linked data being a means to an end. I think the second point that jumped out at me is the importance of telling the story. And that what we're talking about is not just technical details of how can we link these specific variables with those, but how can we make sure that the broader community, the public and others understand why this matters, which I thought you were highlighting very well with some of the examples from the university. The third point that I saw is the benefit of long-term institutional relationships. I think you highlighted very well, this doesn't happen overnight. So how can we create incentives with philanthropy, with universities who are maybe geographically close to the governments they're serving and others, so that it's a long-term relationship as opposed to a one-off thing for individual projects. And the theme that really jumped out at me from what Emily mentioned as well is this importance of kind of two-way communication and respect, and that the questions that researchers are answering really need to be drawn from the priorities of the community and the priorities of the government partners that they're working with. The fourth point that I'll highlight is that a lot of what we've been talking about, I think, over the last few days, highlighted the importance of building capacity, including within individual government entities, right, within state and local government. And one question that I have is whether there's a way for us to see philanthropic investments, to see academic resources as kind of being a means to scaling that a bit more. So in addition to building capacity within, to what extent can these kinds of resources build capacity from the outside as well that governments can use and leverage? And then the final point that really jumped out at me is this responsibility that you highlighted in really thinking carefully about, and I would argue also rigorously testing, whether the tools that we're creating are actually having the effect that we hope they do, right? So we were having a conversation over lunch with Emily on predictive analytics tools. I think are a great example of that. We can all imagine how they could be incredibly helpful. We can also imagine how they could potentially be harmful. And so how can we commit to ensuring that we're also testing these things rigorously to make sure that we know what the effect is for different communities very rigorously, as opposed to to hoping that the effect will be what we see. So those are a few things that jumped out at me, but I'm very interested in continuing the conversation.
Thank you, everyone. I hope you'll agree that that was a terrific panel. I think we should give everyone a hand. Okay, I feel like maybe we'll get the bonus points as the research panel for the group that got us back on track time-wise, because we've got 20 minutes left for conversation, and then we'll be totally back on track. Yes? Okay. So I want to open it up to the floor here to see if anyone has questions they want to pose to the panel. I see one back there. Is there a microphone wandering around the room someplace?
I'm going to ask a question that's probably selfish because it's something I've thought about a lot. I used to be in academia. I'm now have access to a lot of administrative data. And I often think about how there are resources in the academia data and all those longitudinal studies that people have done, et cetera, that nobody ever uses over in the side of the house where they're working with academic data, with administrative data. So Emily, earlier you brought up, we don't really know how many of these children are actually being abused. We only know how many of them come to the attention of child welfare, and we know that that's conditioned on race. We know that that's conditioned on poverty. But I would ask the academics, are there data sources available that you can think of or that you could maybe work with your universities to make available that might speak to some of these population level information that would take us out of the box of having to rely on institutions and their biases when we're trying to understand broad social problems like, say, child abuse?
That's a great question, and it speaks back to the problem of so much incredible information buried in these academic journals with language that most people can't understand. How do you get that information out there so that it's people can use it and it can be implementable? And it is one of the challenges, and one of the things I'm really taking on as the new dean is this idea of public scholarship. And I don't want to make it sound either like it's just disseminating the knowledge from on high. It has to be a partnership, because you can build it and they will come never works, right? It's got to be, what do people want, and then it's a relationship, and then you try to provide it, and then ideally academics can do what they need to do for their own careers and also do what the community does for their needs. But the problem is the speed up of life. Everybody's so busy, and what ends up happening often is that you say, well, often people go into academia because they are activists, because they really care about these issues, and then they get sidelined by life. And that's, so they say, well, I'll get back to that, making this information usable in a more egalitarian or friendly way. And they maybe they do, but in their 40s or 50s, So I really working with the other leaders to think about how can we make these links stronger, more sustainable? How can we tell the stories in ways that people can understand, and yet have our young people have the security of their employment as well? And there's no ready answer except that we all have to work on this together.
Just very briefly, I want to approach the question a slightly different way very quickly. I think that one of the opportunities we have is a lot of academic institutions and researchers are still investing in large-scale surveys. We need to make very explicit when we're going through the consent protocols that individuals agreeing to participate in a particular survey are also permitting the access and linkage of that information to administrative data. I think that would go a long way. It's something that historically we have not done well, but I think the opportunity to, now that more administrative data is being freed up for research, thinking about ways of connecting that with other data collection methods will be huge.
And maybe I'll be a bit of a wet blanket with apologies to say that it's a good question, and I think we should be more aware than we are sometimes of the limits of administrative data. Among them, there's the lamppost problem, which is you tend to solve the problems that you have data for. Sometimes to be less thoughtful about the question you really needed to be getting an answer to. That said, administrative data is inexpensive and getting cheaper in a lot of ways, right? At a time when the direct survey work is kind of moving the opposite direction. So I think a lot of the conversations, including federally, have been around how to supplement those old survey-based measures with new administrative data. It's a real challenge. It's especially a challenge at a time when we're, syncing the census. So that's something else which needs greater attention.
Hi, Damon Francis from Health Leads. I just wanted to thank you for saying data aren't neutral, and just highlight really that lamppost problem and how bad it really is. So a couple examples. You know, in healthcare, the 5 most common presenting symptoms for complex trauma or PTSD are all physical symptoms. So those get coded in a claim and sent up, and trauma remains invisible because we've coded a physical symptom instead of coding the accurate diagnosis there. In Cleveland, which you talked about, there was a great study recently done showing we underestimate the risk of cardiovascular disease by about 20% using models that the American Heart Association has developed for what is the risk of heart disease. So we're under-treating people, particularly in the communities you talked about, because our lamppost, you know, is over here. And that's not a neutral lamppost. Like, that's the thing we really, really deeply have to understand in this room, is that lamppost is 400 years of racism, you know, centuries more than that of sexism, right? It's not a neutral lamppost. These data are not neutral. We really, really, really need to understand that as we talk about this. A lot of the challenge of interoperability is, how do we get people's experiences? That study you talked about being done, showing that kids who grow up in horrible homes have horrible outcomes. Why do we need that kind of data to contract for a child to grow up healthy? Because we've invalidated the experience of people who live in communities, and we've validated quantitative evidence. Like, we have done that as a society, and we are part of the problem here. So we're actually looking to change ourselves with the work that we're doing here, and we really need to start having that conversation.
All right, so I'm going to be the brave person to respond just briefly on that, which is, I totally agree. I hear you in every respect. One of the things I think we do have an opportunity to do is, though, to think about how we can use data to surface some of the inequities that continue to be perpetuated. And so, to give you a very, very, again, concrete example, when we look at this algorithm that we've built that would help to triage reports of abuse or neglect, one of the things we've tested is the error rate different for Black and white and Hispanic children? We don't find it is. That does not mean that there is not bias in the data and in the algorithm. There absolutely is. But you know what else? We have current bias in our human decision makers too. And what the algorithm helps surface is that when we look at those lowest risk children, so when I take the 10% of kids and referrals in California where the algorithm would say that they are very, very low risk, they are unlikely to have future child welfare system involvement, they're unlikely to be placed in foster care, and we look at who are we screening in, we see that we are screening in 70% of Black and Hispanic low-risk children, and we're screening in about 55% of low-risk white children. And at the other end of the extreme, when we look at the highest risk kids, we see that we are screening out more high-risk white children. So if anything, we're kind of under-surveilling or under-intervening there, and we're screening in kind of different numbers of Black and Hispanic children. So I bring that up not because it answers your question and not because it's the solution, but because I do think it's also important to remember that we have systems right now that are operating with an incredible amount of one-off clinical kind of discretion. And I do think that if carefully deployed, some of these algorithms and data analytics can actually help to surface where there's unwarranted variation and can start to course correct systems that have historically been tremendously biased.
I will just add, I mean, I strongly believe that as well. Moreover, I'm afraid that unless thoughtful people engage with this, perhaps from universities, and from civil rights organizations and other groups that are very mindful of the downside risk, that what we'll get is less thoughtful commercialized algorithms in public service, right? So the question is, what does it mean to engage productively here? And I would just add, there's probably an opportunity for this room to inform some of those advocates who are kind of our canaries out there. They're very watchful of the questions that they should be asking. Sometimes I'm in rooms where there's a very strong kind of social justice pushback against some of these uses of data, which I appreciate, but I worry that the kinds of accusations that are leveled at the technology are not the ones that I'm most afraid of. And I think that we probably need a better list of kind of critical questions to ask public decision makers about deploying these.
Yeah, I just wanted to add, it's such an interesting question because there's there's so many pieces to this. I'm thinking of the census data that's now going to ask the citizenship question, and then what a loss that is to not have that data, even though a lot of that data in the past, as we know, has been used in biased ways, but nevertheless, it gives the opportunity, the possibility of working for progressive causes. And a lot of my work is in France, where there is no data collected on any kind of race or ethnicity or religion. And the idea is that therefore we're a post-racial society, and we can we won't reify any of those categories. But the problem is, if you look at the actual discrimination in housing and employment, you can't prove it because you don't have any data to work with. So I totally agree with you, and I spent most of my career is critiquing the sort of idea of neutrality of most kinds of data collection and use. On the other hand, without it, we are also in a different. I'm not saying that you're not saying we should not collect it, but it's really complicated. And I'm just thinking also of I do a lot of work on migration of all the DACA data that was collected pre-November 2016 that was for a progressive cause, and now that data is in the hands of a government that can use it to identify those kids. So it's, and a lot of my work on migration in Europe, I was interested in health data for migrants. They have this e-health thing where they would move from country to country, and so they didn't have to get vaccinated at each different country that they went to. There was an attempt by the EU to have a e-data health record, but then Austria turned over to the far right, and as soon as that, and then that data is controlled by them, and so they know what about these migrants that otherwise would probably want to be underground. So it's your question just raises so many issues for this room that I think have got to be central to any of this discussion going forward. So thank you.
So this is a really great conversation. I'm glad it started with sort of the lighthouse effect. But I want to come back to where it started just slightly before that in terms of administrative data. And I want to tie all of this together in a little bit. Not all administrative data is useless, right? So some administrative data can actually be helpful if you're in an area where you don't have that administrative data that's very simple, like gender or whatever. But on the other hand, I agree completely in terms of healthcare data. Part of the problem is that healthcare data that comes from claims is completely wrong from the clinical perspective, because it uses exactly what he was describing in terms of, in order to get paid, you have to do these things. And so we have to be cautious about using data that's collected for one purpose to solve a different problem, because it doesn't cross over. And so what I think the lesson is for this group is, as we go forward and we look at data sharing, we have to remember that garbage in is garbage out. We have to remember that not all data is equally useful, and that we need to be able to stand up and say, okay, if this data was collected in this way, right, so it depends on how the data is collected, then it may not be appropriate for that purpose. That doesn't mean it always won't be appropriate for that purpose, but we need to at least keep that in mind.
Just a very quick response to that. I think that's an excellent point. And I think it also speaks to the importance of, no matter what systems that we build, the importance of having humans who are going to use that data talk with other people who understand it. And I think that speaks to a couple of things. One is the importance of these long-term partnerships where you have that trusting relationship and you can actually ask questions. The other is that even if we document data very, very well and we describe the variables, we still want to make sure that there are pathways for people to actually talk to the original collectors of the data and really understand that. And I think the people in this room are particularly well positioned to try to build that in, build systems in place for that, so that if well-intentioned researchers within and beyond government, right, or within and beyond academia, get data, there's some requirement that they can have a process, whether it's speaking with a human being or having really good documentation to understand who's in the data, who isn't, where did these variables come from in the first place. That's a great point.
Neil Halfin from UCLA. First of all, I want to raise an issue of a sort of an alternative data universe that connects to this administrative data. I think the administrative data is really, really useful, and I think what Emily's doing for the state of California is creating a real resource for the entire state in terms of heading us in a different direction. But there are other kinds of data that's being collected around the world on children that's quite different and moving in a different direction. And that data is looking at population level changes rather than individual level changes. And so, and probably the best places that are doing this now are in Australia and in Canada, and we're starting to do some of that here. And I'm somebody who I created 2 national surveys that are in use, and California State Survey that's used all the time. And I'm a recovering survey research person doing that. This kind of data, and one of them, it's called the EDI, it's the Early Development Inventory. It measures children in a holistic way in terms of their cognitive, social, language, physical, and emotional development. And it's measured on all the children in the community, and it's done with the community, and it's handed back over to the community. And it tells you about all the children in the community. And what it allows you to be able to do is be able to see the inequities in the community. In fact, Michael Marmot, who's sort of the reigning king of health inequality in the world, when asked what the best measure of inequality and the health inequality, he said the EDI and what they're doing in Canada, because you see the social gradient really clearly. You also see the parts of the community that are doing much better than you would have thought they would do based on their poverty and other issues, and you see areas where they're doing much worse than they are. And the reason why it's important is that in the work around poverty and inequality, we've had one kind of model that we've used for a very long time, and that is bringing up the tail of the curve, identifying those kids that are vulnerable, those who are down at the tail end, and figuring out how to sort of move them out of harm's way. And I founded something called the Center for the Vulnerable Child at Children's Hospital Oakland. I believe deeply in that kind of work needs to be done. But as we've become much more unequal in our society, that curve, the bell-shaped curve on any outcomes, is skewed way to the left now. Skewed so that we have more and more and more children that are sitting, so you have 50% of the kids in the state of California in the United States that are below or low-income children. So we're not talking about marginal risk anymore. You're talking about median risk. And we need to be thinking about median risk strategies rather than marginal risk. So you need whole population data sets that are being done. The other thing, so that you can think about not how you bring up the tail of the curve, but how do you shift the entire curve for the population, because that's where you get the biggest impact. Because you can't deal with inequality at the tail end of the curve. It just doesn't work. It's cleanup operation. You can't do it. You can't get enough leverage. And we've proven that in this country for the last 30 years, that, in terms of what's happening. And so there's a whole different kind of strategy that comes out of it. And if you actually look at the other way where science is taking us, is really thinking about the trajectories of children's lives and actually improving those trajectories, starting early using the brain science that Janice was talking, and how do you leverage that science early on and do stuff. And it's not just about the social determinants of health, it's about the social ecology in which children live. It's about the entire ecosystem. How do you change the ecosystem? Not one social determinant. It's not about housing or poverty or ACEs. You have to deal with all of it together in some way. And that's what a lot of the place-based initiatives are struggling to try to figure out how to do. But what's developing in Canada right now, and we're starting to deploy here, is they have a whole data system that's being developed in Vancouver, where they measure kids at age 5, and then at age 9, and then at age 11, and at age 15, and they're measuring the trajectories of the entire population. So they're not using cross-sectional data anymore. They're using longitudinal data at a population level, and that's data is residing in the communities, and the communities getting that data and making it actionable for them. So it's not the data that the system owns, telling them what they're about, the community's about, but it's the data the community owns, and it's about their trajectories and what they're doing. And what they're doing in Canada now, in Vancouver, is they're linking that data with all of their administrative data, their vital statistics data, and health data, and all of that, so that they can get a 360 view of individual kids, of neighborhoods, and of the whole population. And I only raise this because that's kind of the future and where we should be thinking about, you know, the intersection of, you know, interoperability 2.0 that actually intersects with a children's data system that makes sense for the 21st century, not just continuing to use old data that doesn't tell us all that we need. We can manipulate it all we want. We'll find out certain things for certain vulnerable kids, but we really have to be thinking about how do we redesign our data systems to answer the questions and get at the equity issues, the race issues, but make it so that communities can actually own the data and use it. And you're seeing in places like in Pasadena and Hartford, Connecticut, where they're taking this data and they're taking it to the neighborhoods and handing it back to the parents and the communities and saying, this is what your community looks like. How do you want to deal with it? And this is what the next neighborhood looks like. And it's like holding a mirror up to people for the first time. They've never seen themselves and they haven't seen their community in that way. And it's very, very powerful, and it's very different than what we're talking about.